Hi, I'm Mina Malik Hussain, and this is the coffee table. And you know, one of our most favorite things to do on the coffee table is get doctors on and then pick their brains about their specialties. And I love doing that. And I'm really excited today because today we're talking about all things dermatology and skin related on the coffee table. And I'm also really happy, and you might have guessed, because I have one guest with me on set today. And you know how rare that is, aajkal. So I'm so happy to be welcoming on set with me today Professor Dr. Atif Kazmi. I think that if you live in Lahore, then the Kazmis need no introduction when it comes to skin issues, but still. Professor Kazmi, Dr. Atif, is the president currently of the Pakistan Association of Dermatologists. He is a former head of the dermatology department at King Edward Medical College. He is a member of the Pakistan Medical and Dental Council, and right now he is the head of the dermatology department at the University of Lahore, where he also practices, of course. And we are joined from Islamabad by Dr. Mavish Aftab Khan, who is a consultant dermatologist and cosmetologist. She is the head of the dermatology department at Rawal Institute of Health Sciences in Islamabad and is also a diplomat of the American Academy of Aesthetic Medicine. Welcome to the show, doctors. It is lovely to see you, Dr. Atif.
Same here.
Wonderful. Thank you for taking out the time and being with us today on the show. So let's start at the beginning, which is what I always like to do, is that when we are talking about dermatology, then we are talking about the skin. And I think that a lot of people tend to kind of forget that the largest organ of the body is the skin. And yet we don't have that many dermatologists. And I think that a lot of people, skin seems to take a backseat to other more important fields of medical specialization. So why do you think that is?
Personally, I feel that, as you have rightly said, that it is the largest organ of the body, and the skin of the face is the mirror of mind. It reflects everything. So nowadays, if you feel that a doctor who does his or her graduation, and when they have an option of joining any specialty, I tell you that the top merit students, especially the females, they opt for dermatology.
Oh, is that right?
Yes, and you would be amazed to know that initially, when I did my graduation way back in 1980 from King Edward Medical College, it's around 40 years more than that. So not many people knew anything about dermatology.
Yes, quite right.
But now, since the interest in dermatology is not only in skin, it has shifted to cosmetology.
Yes, that's right.
So I was wondering one day that whenever I attend conferences, seminars, workshops, meetings in dermatology, maybe national or international, 80% of the audience among dermatologists are females. And I wonder that what would happen after 20 years when it would be 100% females only in dermatology. There would be no males at all.
Yes.
The reason is that more females are switching on to this speciality because cosmetology has become a part of it.
Yes.
In dermatology.
Yes.
And then ultimately, females feel that this speciality is a bit easy for them.
Yeah.
They can cope up with the family.
Right.
Their husband, their children, their family. Because if you are a surgeon, or if you are even in medicine or pediatrics or gynecologist, then you are in a lot of trouble because you are always busy with the patients and you have calls at odd times, getting up at midnight, going for an operation if you are a gynecologist.
Yes.
So I think dermatology now is one of the leading fields in the whole world. And you would be amazed to know that nowadays in USA, I have been trained in USA, I've been trained in UK and all over the world. In USA, it is so difficult to get an internship in dermatology.
Excellent.
That they would...
I'm glad to hear that. But clearly it's a field that is highly lucrative. And like you said, it's also presumably low stakes in the sense that people don't die from skin disease.
Yeah,
people,
do they? Generally, no. People,
you never know.
There are dermatological emergencies. My father, late Professor Ghulam Shabir, he was the founder of dermatology in Pakistan. So once his colleagues, while I was a student, they mentioned to him, rather they inquired that, Shahji, you have only opted for dermatology, that a patient of skin remains a patient throughout one's life. And I still remember a joke that there was a dermatologist who had only one daughter. And she was also a dermatologist. So once that the daughter was to be married,
Right.
so nothing was given in the dowry to the daughter. And you know, dermatologists are very rich people, not me, but generally I'm talking.
I'm sure you are too.
So everyone inquired from that dermatologist,
Yes.
look doc, what has happened? You have got only one daughter, you have
Right.
got a lot of fortune, you have not given anything to your daughter. So he said, I do not need to give anything to her. I have given her the name and number of my patients because they would never die. They would always be in
They'd
skin
always
problem.
be in need.
And then she would be the one who would be earning money from those patients.
Well, that's great. I think
Yeah.
that's a great reason to not give dowry to any daughters. You give her a great education, you set her up in life
Yeah,
to succeed.
yeah.
And I think that's wonderful.
This
you know.
is-
So, hi, Dr. Mavish. Since we're talking about cosmetology, you are a female dermatologist who is also a cosmetologist. So, first off, tell me, what's the difference between dermatology and cosmetology? Is there a difference, or is it kind of like a matter of specialization?
Yes, I would like to add, not only the skin is the largest organ, as you previously said,
Yeah.
but it's the most important organ. This is the only organ that interacts with your social environment.
Yes,
You
that's
attract
true.
people, you attract, obviously, if your skin is healthy, you look attractive. So your social interaction becomes more important if you have a healthy skin. Now, coming to your question, there's a big difference between dermatology and cosmetology.
Right.
Dermatology only deals with your clinical diseases,
Right.
diseases like acne, melasma, or any genodermatosis. Whereas cosmetology relates to all the treatments that enhance your skin health, that can enhance your beauty,
Yes.
that can add to your natural beauty. It all comes under the umbrella of cosmetology.
Right.
Now it's trending, as Dr. Saab said previously, rightly. It's
Yes.
now booming.
Yes.
Cosmetology is booming.
Great. I'm so happy to hear. I want all the doctors to make lots of money. So I'm just saying, wait, that's fine. but Dr. Mavish, why is it booming? Everybody wants to now get sort of laser things and chemical peels, and I'm not judging anybody for wanting to look nicer, but do you think that it's a matter of awareness? It's also a matter of procedures being available now for people. Like, I think that 20 years ago, you couldn't get certain procedures done, but you can now. And do you think that it's also something to do with the fact that a lot of dermatologists want to branch out into different kind of related specializations as well?
There are a few factors, Mina. Actually, if you look back 10 years back or 20 years back, you only saw your face in the mirror, I think.
Yes.
And now every time you are observing your face, you are comparing yourself with the help of this social media.
Oh, yes, that's true.
Social media not only creates awareness, but also puts a lot of pressure
Yeah.
to our younger generation
Quite
to be
right.
more perfect, to look more beautiful. This is the main reason.
Yeah.
The cosmetology or aestheticians are booming.
Yeah, I think that's a really way to put it, Dr. Mavish, is that previously we weren't looking at ourselves through cameras and through screens and through filters all the time. And we'll cycle back to this in a minute, because I think that's a sort of, your self-perception and like your skin, like both of you have said, is like your first kind of interaction with the world. And that's really important. But Dr. Saab, I am still curious about, why do you think that, there are some fields of medical practice that are seen as easier, but don't you think that's a little unfair also? Everybody has to do an MBBS, everybody has to have a specialization, and dermatology is actually really important. And there are many skin conditions that are, for example, like you have to work in tandem with other doctors as well to sort of create balanced diagnoses as well. Like there are comorbidities with other diseases, and it's sort of, one is part of medical ecosystems. Isn't it kind of unfair to be like, oh well, dermatology?
I agree.
Like people say this about dentists also, that
Basically, what happens is, it all depends. It varies from person to person. Like personally I feel that because I've been teaching for the last 40, 30 years now, when the medical students, they are in third year, fourth year of a medical school, they start deciding at that moment which field they would opt for later on after doing their graduation. Right? It's not necessary that every person should come into dermatology or cosmetology. No, majority of the people, some people, even my friends nowadays, oh, what the speciality? Atif, you are a lazy guy. Skin specialists are lazy people just sitting on one side, writing prescriptions. This is acne, melasma, hair fall, alopecia, eczema, psoriasis. But then it all depends. It depends upon your temperament. It depends what sort of, if you are a very aggressive person, you would like to be a surgeon. If you want, you can become a neurosurgeon. Now I tell you, there are many people who are opting for neurosurgery. And it's amazing to see cardiac surgery. They are very, lot of innovation. That is what matters. But I feel that in dermatology, the main thing is that initially, like rightly said by my colleague, Dr. Mavish, that social media, which is the one which is nowadays with all these electronic and print media, a lot of channels around, people have become very conscious about their skin. Initially, when I did my graduation in 1980, about 40 years ago, female would never come to me with a single freckle or single pigmented lesion on the face. They would forget it. Oh, come on, no problem. Now, a female having a pimple, having a single freckle would run to me, Dr. Atif, please get rid of it. I tell them there's nothing to worry about it. It's not malignant. It's not cancerous. You won't get any. But no, I would like to get. So what happens is once you are in social media, once you are interactive, and then our women now, they are more educated.
Quite right. And men, because you know, a lot of men also have cosmetic procedures.
So now I personally feel, and I always say that skin, I told you initially, that skin of the face is the mirror of mind. Now when you go, when a girl has to be engaged, has to be married, the proposal is there. The in-laws come and see the girl. They never ask the girl parents to show the X-ray chest. The blood report, the urine report, their gastroendoscopy report, they just see the face of the puppy. Now, face is a very important part, the facial skin in a female. I tell you, I have
also
seen...
males, I keep wanting to sort of go back and say, like, men also should have good skin.
No, nowadays, men have also become very conscious regarding their skin. They are very aware. Awareness, a lot of awareness among the men. Men have started using cosmetics.
But Dr. Saab, don't you think that that's a good thing also, that looking after our skin is a really good thing to do? And it's important because, you know, there are lots of different reasons why it's important to look after your skin.
Basically, you know, there are two aspects to this. A male should look good. I would like to look good. Why not every male? But then you should look good, but do not start competing with females.
But if we're looking at it in terms of skin health, why is it important to have healthy skin? Because I think a lot of people feel like it's vanity to look after their skin, and then it doesn't matter, just wash your face with the same soap that you had a bath with and off you go.
It's again your attitude. It's again your temperament. I've seen people, they don't shave their skin for days and days, weeks and weeks, very shabbily dressed up, and they are not bothered about their hairs, unruly hairs, the face is like that. And this is the reason that these people, they get premature aging into their skin. Then this is the reason they come to us, Dr. Atif or any doctor, look at me, I've got excessive crow's feet, laughing lines, premature aging. What is premature aging?
Well, I want to interrupt you here because I think this is a very good point you've made. We're going to take a very quick break at this juncture, at this suspenseful moment about premature aging. I think we're all obsessed with it. More after the break. Stay with us. Welcome back to the coffee table, where we are having a riveting conversation about skin and healthy skin and looking after your skin and how to prevent premature aging with dermatologist extraordinaire Professor Dr. Atif Kazmi and consultant dermatologist and cosmetologist Dr. Mavish Aftab Khan. So Mavish, as a cosmetologist as well, I'm sure you get a lot of people who come to you with these issues that Dr. Atif was also talking about. But do you think that a lot of premature aging and a lot of cosmetic issues are actually caused by people not looking after their skin properly?
Yes, this is true. This is absolutely true. one thing which is more important to distinguish between premature aging and chronological aging.
Yes.
One aging is that you age according to your age, when there is time, or when there is time to age.
Yes.
Premature defines the aging when it occurs before the time. And it absolutely happens with the people who never care about their skin.
Right.
Don't have a healthy lifestyle, don't have a healthy diet, unnecessary sun exposure, unnecessary use of cosmetic products. Nowadays, as everybody knows that there is a craze of being looking beautiful, craze of makeups.
Yes.
So people put on a lot of unnecessary skincare products.
Really? Like
that
what?
Doesn't suit their skin. Like many whitening creams. You all know that.
Yes, please. I want to.
There is
I
a
want to
craze
sort
of
of,
thing. There is the
yes. So what you're saying is that one big factor in the reason why people's skins are prematurely aging is because they use a lot of beauty products which are terrible for their skin, and whitening products is a big culprit in that. I want to sort of repeat it because it sounds ghastly.
Can be one of the factors. It can be one of the factors that can cause premature aging. If you are using the products which are not appropriate for your skin, for your age, basically, you can prematurely age. There are a lot of cosmetic products which contain potent steroids or mercury, harmful chemicals. Then really can damage your skin, cause premature aging, wrinkling, erythema, redness, photosensitivity, and a lot.
That's really full. And you also mentioned that products need to be appropriate for your age also. So as a medical professional, what is an appropriate age to, for example, start wearing makeup? Because I think that this is also one of those things, like you said, like a lot of younger girls and a lot of teenagers are really into makeup and into skincare, and there is a lot of awareness, but it's not necessarily always age appropriate either. And I think that as a parent, I could say to my child that, well, I don't think that, an X age is appropriate to be using these products, but as a medical professional, what age bracket do you think is a sensible one to start, sort of using these things?
As long as your skin is healthy, you don't need to put any makeup until and unless there is a big function. You need to apply the makeup, and that's it. This is my stance. You first have to make your skin healthy naturally. Then you can put on makeup. Obviously, that can after 20 or 25.
After 20 or 25, wow, I think a lot of teachers watching this show are going to be like, no, bye, I'm out of here. So, but Dr. Mabish, you define healthy skin.
Healthy skin. Number one, there are few components which can give you a sense of healthy skin. Number one, if your skin is hydrated, well hydrated, it will glow. There will be no wrinkle, fine wrinkles that can indicate dehydration. There will be no flakiness. There is no redness over your skin.
Right.
Or the pores are not enlarged. There are few points which can tell you that your skin is healthy or not. If there is some acne, pimple, if there is rosacea, if there is erythema, if there is photosensitivity, it means your skin is not healthy. You first need to address your issues, current issues, improve your lifestyle, improve your diet and hydration. Then treatment definitely will work.
Right, excellent. And I believe skincare has a lot to do with, as much to do with what you put inside of your body as it does with what you put on your skin. It's a sort of, it goes hand in hand. So, Dr. Atif, tell me, I think that a lot of times in this part of the world, we don't take sunscreen seriously because we're like, well, we're brown and our sort of natural melanin is protecting us from sun damage. But sun damage is a big deal. It's something that we should be more careful about.
Now, our type of skin, we have a lot of melanin, and that melanin protects our skin against the ultraviolet light, the side effects of the ultraviolet light, especially the skin cancers.
Yes.
We are lucky, we are blessed that we have brown skin or dark skin where we get minimum of skin cancers. And skin cancer, squamous cell carcinoma, basal cell carcinoma, malignant melanoma, Bowen's disease, and so on and so forth. But if you go abroad, if you go to Australia, if you go to New Zealand, if you go to Scandinavian countries, you would find all those people lying on the beaches. Why do they go to the beaches, and why do they lying there? They're applying the oils and they're having that lot of sun.
A tan.
Exactly. They want to tan their skin so that they can avoid skin cancers, malignancies from skin. We fortunately, we do not have much of skin cancers. Our skin cancers in Pakistan are generally seen in the northern areas, KPK, where people are very fair people.
And so they're also sort of higher.
Yeah,
so
higher.
The intensity
altitude,
of the sun is different.
Yeah, ultraviolet light is more there. Why do we ask people to apply a sunblock when they go to mountainous areas? People going to Murray, Nathia Gali, Kagan, Sawat, we always take the sunblocks with us because the chances are that when we are going above the sea level, 7,000, 8,000 feet above the level, the ultraviolet rays, they are more destructive for the skin. So this is the reason we must apply the sunblock. And nowadays, like as summer is on, so we must have a sunblock with us whenever we are out into the sun.
So regardless of whether you're in the mountains or not, you should be wearing sunblock.
Certainly.
And what's the connection between sunblock and your skin aging? Skin aging.
Aging, yeah.
Like wrinkles.
This is very important. Now, skin aging, as we have been discussing this, there is a genetic relation of skin aging as well.
Really?
Yeah, this is very important. When people come to me, they say, Dr. Saab, I have kept myself very well throughout. I look after myself, my skin. I've not been using much cosmetics. There is no wear and tear of the skin. But my mother, she had premature aging at around 30 years or 40 years of age. So it is genetic as well. Genetics, I always maintain one thing, that genetics is the most important thing in one's life. Why do we say that you look like your khala, you look like your mamu, you look like your baba, you look like your... This is genetics. Some say your eyes are like your mom. Some say your nose is like your dad. This is all genetics. And this is the reason genetic disorders are there. We will be discussing genetic disorders if at all there is time. And you would be amazed to know that now a lot of genetic disorders in skin diseases we see. And ultimately, this premature aging could be due to less use of sunblocks, especially by fairer skinned people. Then they move out. Like as nowadays, the females are more into jobs. They are marketing jobs, fieldwork jobs. So if a female who is into a job, especially in the outdoors, and she is not using any sunblocks, especially in the summers, she is bound to have premature aging, and ultimately the wear and tear of the skin is lost. And one more thing I would like to mention here, which is very important for premature aging and for the wrinkling, that I always say to the showbiz people, all the anchors are my patient. All the showbiz people are my patient.
You know many secrets.
No, when I'll write my biography, then you would know that whoever it is and what problems they had. So when they come to me, I just tell them, advise them one thing, that when you are off from your program, please just go to the washroom and get rid of this makeup before you go back to the home. Don't wait till going back to your home, because the cosmetics that you've applied, any cosmetic which you are applying is having chemicals. It contains chemicals. And those chemicals, if they are there for a longer period of time over your skin, over your face, or over your chest or anywhere, they are bound to be absorbed into your skin and cause a lot of skin problems later on in your life.
But isn't this sort of like a vicious cycle, Dr. Mavish, where you put on cosmetics to look a certain way, but then those cosmetics are also not good for your skin, and then they're making your skin worse, and then you put more cosmetics on top to make yourself look better, and sort of, this sounds like one is being trapped by the same products you're using to make yourself look better.
Yes, therefore it is very important to look into your skin health. Make it healthy by your lifestyle, by your diet, by your habits, not only by putting on makeup again and again and again.
Dr.
Atif rightly said that. Dr. Atif rightly said that you have to remove your makeup as early as possible. Otherwise, you will end up with all the skin problems, starting from acne, pigmentation, melasma. Anything.
Now, since we're talking about premature aging, Dr. Mavish, how do you know that the normal wear and tear of your skin is appropriate for your age? Like, how do you know that at this age, the wrinkles that I have on my face is just appropriate to my age and it's not premature aging? Like, how are there ways to differentiate so that, we're not unnecessarily panicking looking at your face in the mirror?
Actually, if I tell you truly, aging starts at the age of 20. You will wonder. At the start of 20. So after 20, you must need to take care of it. And the important factors in taking care of your aging is sun protection.
Which we've been talking
As
about.
long as you religiously follow sun protection routine,
Yes.
you will age slowly. And what are the signs you were asking? There are few frown lines visible, lines around your eyes.
Right, okay. And lines around your eyes.
Here. You can have lines around the mouth, drop of the angle of the mouth, and like sagginess of your jowls.
Of your jaw. Okay.
These are the few signs which can signify your aging. The level of these signs signify your age.
Yeah. And then, of course, it is genetic, like we've been talking about with Dr. Atif as well. But then there's also your lifestyle and the products that you're using and the general sort of approach you have to life. So do you think that, what role does sleep play in the health of your skin, Dr. Mavish?
A lot of role to play. Sleep, basically, if you have a good sleep, you will look definitely good. Minimum 7 to 8 hours sleep. 8 to 12 glass a day of water and sun protection. These three basic advices I always give to my patients. If you want to have a healthy skin, just follow these basic 3 tips. Have a good sleep, healthy sleep, quality sleep. Not only just with mind
somewhere
the weekend
else.
and you are just sleeping.
Although,
Sleep
and Dr. Atif, what do you think about our exposures, perpetual exposure to screens also, where, you know, we're looking at a phone, looking at the television, or just generally are sort of, you know, because from what I understand, all of these screens are emitting blue light. So what effect is blue light having on our skin?
Before I discuss this blue light, one of the most important causes of this premature aging and wear and tear is the anxiety and stress nowadays. Let me tell you.
It really seems to be like the cause of every bad thing.
Every bad thing. Stress, hair loss, stress. You get alopecia, stress. I get my patients, female coming to me, halos, all blackening of the eyes, around the periorbital pigmentation. When I ask them, Doctor Saab, lot of stress. Doctor Saab, I'm a working lady. Doctor Saab, I have got children to look after. Doctor Saab, I have my mother-in-law, my in-laws, this, blah, 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 blah. So the stress is playing a major role nowadays in one's skin's degeneration. This is very important. And like as you were talking to Mavish regarding the sleep pattern, nowadays you tell me who goes to sleep before 12 midnight? No one. Everyone. And while you were asking me that effect of screens, like as laptops, computers, I would go one step ahead.
Really?
You are talking of this. I say the most problematic thing is this. We all, you tell me, your children, my children, everyone, your husband, my wife, everyone, we are all on this. Even we are not having eye contact. My children, they don't have eye contact with me. I ask my son or daughter, hi, look at me. Dad, I'm talking to you. Okay, Dad.
I'm listening.
So now the problem is that when we are all accustomed and used to all these artificial things, we are bound to have lot of skin problems. And what is happening to the eyesight? I'm not an ophthalmologist, but if you see nowadays your nephews and nieces, your cousins' children who are hardly 4 or 5 years old, they are all wearing side glasses. They go to an ophthalmologist. The reason is they are sitting on all these laptops, computers, on the games, and they are playing the games. And when the children are playing, their eye contact is just like this. They are always playing the game. So this is the reason.
And then blue light is also, from what I understand, it makes it more difficult for your brain to switch off so that you can get quality sleep that Dr. Mavish mentioned as well. It's not just enough to just kind of have your eyes closed and you're asleep, but it has to be quality sleep.
This is
restorative.
This is absolutely correct. Sleep doesn't mean that you are forced to go to sleep.
Yes, like a baby.
Like on gunpoint, go to sleep. Otherwise, you are no more. This is not like that. You must sleep, and that sleep should be very sound sleep. And that sleep should be at least for 6 to 7 hours. This is not a sleep that you go to sleep at 12 midnight or 1 or 2 in the morning, get up 5 and then you are getting up and about. That is no proper sleep. And I always maintain on one thing, that sleep is an integral part of your skin, facial skin.
Very important. We're going to take a very quick break at this juncture, leaving you to think about, are you sleeping enough? And if you don't sleep, you're going to look haggard and age before your time. And that is mostly irreversible, I think. But we're going to ask Dr. Saab about this after the break. Stay with us. Welcome back to the coffee table. We're having such a fascinating conversation about skin and why dermatology is important and why skincare is important. But above all, listen to your doctor and don't go around slapping stuff on your face with no information. Hence this show. We have equipped you to deal with all sorts of things. We are in conversation with Professor Dr. Atif Kazmi and Dr. Mavish Aftab Khan. And now for our last segment. Dr. Saab, you've been practicing for so many years. What are the most common ailments that you see in your clinic in Pakistan or in Lahore?
Well, absolutely. Acne, melasma.
What's melasma?
Pigmentation after pregnancy. Big patches. All over the black patches over your cheeks.
Right.
That is melasma. Acne, you know,
Yes.
pigmentation. Eczema. Eczema is a very common problem which is seen all around 12 months of the year. Eczema. Eczemas are genetic as well. Let me tell you one. Yeah, eczema, it runs in the family.
Tell me
atopic
more
eczema.
about the other things and we'll come back to eczema.
Then ultimately, apart from that, fungal infections. In the summers, we get a lot of fungal when people sweat a lot. Then hair loss, alopecia. Alopecia is again due to stress, autoimmune disease due to stress and anxiety.
So there is a difference between regular hair fall and alopecia, which is a proper disease.
Exactly. Then psoriasis.
Right.
Nowadays, it's amazing. You would also be surprised to know, I'm seeing more patients of vitiligo. Jisko pulberry or burst we call in Urdu, vitiligo. And that could be due to obviously cousin marriages, maybe. That could be the one. So apart from that...
That's really interesting. I want to sort of come back to that because we know that consanguinity is very common in this part of the world. You know, regionally, it's very common, and consanguinity is when you keep marrying your cousins. So, Dr. Saab, do you feel like, of course, cousin marriages and this sort of overlap of genes does contribute to a lot of other problems like, you know, glaucomas and diabetes and heart disease and thalassemia and stuff like that. But what effect does it have on skin condition?
Oh, yeah, certainly.
Like genetics and skin.
You would be amazed to know that my father and myself, we described a disease in the among cousin marriages, Punjabi families, and it is mentioned in the reference textbook of dermatology by Rook Wilkinson by the name of Shabir syndrome. By my father's name.
Lovely.
It's a great honor. The first time really anyone from Pakistan is described. And that condition is seen among, as you said, consanguineous marriages, cousin marriages. And the children who are born, they are born with nail changes, peeling off the nails, number one, hoarseness of voice. A child is born, the child would cry like this, the nails have fallen, and then there is peeling of the skin around the eyes and around the genital area. And the child would die within the first 6 months of life. This is what it is. So this was mentioned by the name of Shabir syndrome, and it is still there very much. Now they also call it as laryngo-onychocutaneous syndrome. So this is one of those diseases, very dreadful disease. Children won't survive.
Children don't survive from it.
Then ultimately, when the couples come to me like this, especially who are uneducated, belonging to the rural areas from the villages, I then advise them. They say, Doctor, we had 3 pregnancies. We had 3 children, all have died. Then I ask the families to sit together and I tell them that, look, now you should not have any more children. Either you have to adopt a child or ultimately get separated.
So even if we talk about, for example, vitiligo, which is an autoimmune condition, psoriasis, or alopecia is an autoimmune condition, do you feel that, again, consanguineous marriages and too much intermarrying makes you more susceptible to autoimmune disease?
Certainly, certainly. What I have seen is, in my life, in my practical experience of around 40 years now, that this consanguinity, sanguineous marriages, and ultimately cousin marriages, they all lead to these skin problems. Initially, it was thought that there are other problems, like as Down syndrome.
Yes.
Like as hydrocephalus, like as other problems. But now in skin, we get epidermolysis bullosa,
Ooh,
incontinentia pigmentae, we get xeroderma pigmentosum, ichthyosis vulgaris. And ichthyosis is a disease which is seen fish scales type skin.
Wow.
You go scratch and all fish scales are falling down. People say, "Ye kya ho gaya? What is happening to this?" So now,
and these are conditions that may not be fatal, but they affect the quality of your life in a really serious way.
they may not be fatal. They are not with high mortality, but with high morbidity.
Yes.
Now, who would like to marry a guy who has got fish type of scales? The girl wouldn't like to be with the husband at all. And ultimately, they would feel that this skin disease may be contagious for me or my children. So ultimately, I would say that with the courtesy of your program, that we should get out of the families for marriages. We have got Muslims all over the Pakistan, and why are we looking only at our cousins? Cousins are your brothers and sisters. Forget them. Get out of your family. Let's get
Look
married
outside.
out.
There's a big world out
it's
there.
It's a big world. So we would be avoiding these disorders. And I tell you, this is a total liability on the parents, children with a child having a skin problem. Epidermolysis bullosa. Epidermolysis bullosa is a blistering disorder. A child is born, the first day you deliver a baby, all blisters around the face, around the peripheral areas, around the genital, and the child dies within 6 months.
Oh no.
And you won't be having any normal children in the rest of your life. Ichthyosis, xeroderma pigmentosum, it's a disease with all pigmented lesions at the time of birth, and you get skin cancers after 1 year of age.
Oh my
in that
gosh.
child, the child dies. So
That's
it's very
no life for a child or anybody, really.
What about the parents?
Yes,
you can feel
absolutely.
the
It's so
agony,
traumatic.
the agony, what the parents are going through. A child having this sort of a problem.
Right.
The mother is seeing a child. The father is seeing the child. So,
Dr. Saab, I wanted to kind of come back because I think we're falling down like a terrible hole right now. I want to come back to eczema.
Yeah.
And is it just me when I just think this, but do you feel like clinically also, more and more people are coming down, are sort of being diagnosed with eczema. More people have it.
Yeah,
Why do you think that is? Like everybody's got eczema now.
We classify eczema into two types, exogenous eczemas and endogenous eczemas.
Right.
Exogenous means from outside, endogenous means from within.
Right.
Now, eczema, I tell you, you people wear a lot of jewelry, females. You wear rings, you wear lockets, you wear any jewelry. That can cause eczema. Nose piercing, you can put anything in the nose, that causes eczema. The jewelry doesn't suit you.
So it's an allergic reaction.
It is an allergic reaction. So this we call as contact eczema.
Right.
The female, generally you wear sandals and chappals or a shoe, coat shoe. That doesn't suit your skin. You'll have itching on your feet. That is
But also
eczema.
any male also. Because often I think a lot of times men seem to think that skin problems are lady troubles, but men get it too. So it's okay.
Because when we discuss of jewelry,
I don't know. This thing on my foot has nothing to do with my skin. Like, yes, it does. It's fine. Your
when
shoe
we
didn't
discuss
suit
of
you.
cosmetics and jewelry, then it goes more toward the female. But then obviously males have eczemas. And when we ultimately, the reason is we males sweat a lot. We are outside, we are working, our environment is such where there is a lot of sweating in a factory or in an office, then ultimately we get eczemas.
How much eczema is normal eczema?
Normal
In the sense that having a patch here or there is fairly ordinary?
Yeah, basically, I tell you. Now, generally, you would have observed in your family and among even in your maybe children as well, certain children when they are young, they get hypopigmented white patches and people say this is deficiency of calcium.
Yes.
And people start getting lot of calcium injections to those children and the children are so much scary when children
Whereas
come
in
to...
fact it's eczema.
No, it is eczema. It is due to your dandruff, due to seborrhea. When you have a seborrheic skin, you are bound to have patchy skin over your face.
Oh, because it's falling onto your face.
So we call it as pityriasis alba, that disease, which is a form of eczema. Then apart from that, the children, they get atopic eczema if the parents are asthmatic.
Ah, yes.
Rhinitis, hay fever, rhinorrhea, lot of watery eyes.
If you are sort of allergy prone, if you have asthma or you have some kind of allergic condition, it is more likely that you will have eczema.
You'll have more eczema. We call it as atopic eczema. And that eczema would go up to your puberty life.
Right.
You have to wait till puberty, just apply emollients and not to take very hot, spicy foods, not to take a lot of eggs, take lots of fruits and juices so you keep your skin fresh and glowing. That is what we advise to our patients.
Okay, well that sounds fairly doable.
Yeah, it is doable. It is doable. Yeah. Basically, I would like to mention here, people at times, they are very scary of steroids.
Yes.
Oh, doctor, don't give me, don't
because
prescribe me.
Everyone's always told that steroids are really bad.
Steroids, they would kill me. I tell them that a dermatologist in our armory, steroids has a major role. But then a doctor would know that how much steroid has to be given.
Quite right. So Dr. Mavish, I was asking Dr. Atif what he sees frequently in his clinic. So as a cosmetologist, what are skin conditions that you see the most commonly in your clinic?
The most important skin condition, as Dr. Atif rightly said, acne.
Yes.
Acne, melasma, and the most important, unwanted facial hair.
Yes. So
nowadays, this problem is too much.
Yes. So
this
why do you think that is?
There are a lot of factors again. Again, there is the lifestyle, which leads to the PCOS, sedentary lifestyles, are bad eating habits, eating a lot of junk food, weight gain, type 2 diabetes. These are things, these are conditions prone to unwanted facial hairs.
Yes.
It's the commonest problem I see in females.
And do you think a lot of acne and facial hair issues are probably hormonal as well? And if you address that problem, then these things will also then kind of clear up?
Yes, definitely. There is the cause, underlying cause is PCOS, polycystic ovarian syndrome, which is the basic cause of you have thick hairs over your face. You are facing hair fall problems with cystic acne or severe acne. When we treat the underlying cause, definitely your issue will be resolved.
Yeah. So, Dr. Mavish, if somebody has acne, then what is your advice about skincare routines or makeup use for people with acne? Because I think that a lot of times you want to use stuff to cover your acne up, but maybe that, and we've been talking about chemicals and cosmetics. So do you think that that's actually making your acne worse if you do that?
Yes, it really works bad at your skin. If you have oily skin and if you are facing a problem with acne, just one thing, never ever apply any home remedy or any totka to your acne or pimple. It will heal naturally without any pigmentation if you don't do anything. But if you do anything wrong, it will end up in flares. This is the most important thing.
So no toothpaste on pimples?
No besan at all, no lemon at all.
What about yogurt? You know, people put it on their face as well to make yourself fairer.
Not at all.
Not at all. See, you've heard a doctor. Don't use kitchen stuff on your face.
You can eat it. It will benefit, definitely. It will give you benefits if you eat it, rather than applying your face.
Don't put kitchen stuff on your face. Wear sunscreen. Don't put random tube things on your face without consulting a proper doctor about it. Thank you so much, doctors, for being on the show with me today. It has been a pleasure having this wonderful conversation. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on The Coffee Table. Bye.